I got into medicine because my dad was a physician. He did his residency in Chile, and I went to Chile. I got to see everything that cancer centers offer. The treatments were so interesting to me. All of the resources that we have for cancer patients, all of the support. That patient experience made me decide to be an oncologist. I see patients with cancer 18 and older. We see all types of patients with solid tumors such as lung cancer, breast cancer, colorectal. My favorite one to treat is breast cancer. I really like helping women too. I was also trained in hematology, so I'm also seeing hematological blood disorders such as blood clots or anemias, and also cancers that are hematological, such as multiple myeloma and so forth. Usually when patients come to see me, they already have a cancer diagnosis. The first thing I ask them is, what do you understand about your cancer? What is their support system? How are they doing in terms of symptoms? And then I always like to get the first visit to first educate the patient. I want them to have a clear sense of what tumor type they have, what stage they have, and what are the expectations for treatment, because that will determine the treatment. Sometimes I need to get more information, maybe more biopsies, or talking to my other colleagues with radiation and surgery to come up with a plan. The treatments are not just chemotherapy or targeted therapy. We can see what mutations the cancer has, and then we can target it with monoclonal antibodies or pills that are targeted to that particular mutation. And I always tell them as well, if they forgot to ask me something, to get a notebook and write their questions between now and the next follow-up so that they don't forget. It's really important to have great communication with the patients and their families because we want to build trust. My hope for patients is that now that we have all of these new treatments for their cancer, that they'll get better outcomes. But when they come to see me, they'll be in the best hands. I'll do everything in my power to take care of them and help them get through cancer.